Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Insufferable behaviors. Suppression and Repression, Part 5. Not again. Although many of us can and perhaps do experience various adverse emotional states upon the triggering of unresolved childhood and adolescent trauma, because we consciously remember such events, some of us also negatively react to present moment triggers from painful life situations of the past we are unable to consciously recall. In essence, such memories have become repressed or blocked from one's consciousness, usually due to the degree of suffering we originally experienced, as a way of protecting us from re-experiencing that level of pain again, at least in theory. Repression conditions. Generally speaking, memory repression is often strongest during one's infancy and early childhood, hence the inability to remember most, if not all, our earliest and perhaps most impactful life experiences, because we live a mostly subconscious existence up to age 7. And greater in likelihood the less we cognitively and even emotionally understand, or otherwise make some sense of, the pain and trauma we actually experience, because we possess little if any reference. Just to get by. Those of us diagnosed with and further suffering from post-traumatic stress disorder may experience a wide array of negative and, in perhaps many cases, debilitating emotional or psychological and physical effects, yet are challenged to recall the specific details related to causing the initial trauma. Sometimes because our traumatic experiences were low grade and lasted for months or even years, and we learned to emotionally dissociate ourselves from the ongoing trauma for self-preservation purposes, or we otherwise adapted. Missing something. As challenging as any resolution process might be, some of us could experience proverbial roadblocks in our efforts because there are repressed childhood and adolescent memories that the unconscious mind is preventing us from consciously accessing, something we are missing, to otherwise help us understand why we may adversely react to certain triggers unrelated to other potentially adverse life events.